Thank you so much for having me. Yat she'e Candi Running Bear Yinishya, Hushk Anadzo Nishle, Maidesh Gijni Bashishchin. I am from the Yucca Fruit Hung on a String clan, born for the Coyote Pass people. And today I will share how my work in early literacy, autism identification, and family support has been shaped by Diné values and community guidance. This program of research centers cultural grounding, partnership, and sustainability rather than one-time interventions. I begin this work first as a Diné woman, a mother, daughter, sister, and educator. Before I was a researcher, I was a special education teacher working directly with young children and their families. In the classroom, I saw both strengths and inequities. I saw children who were capable, engaged, and curious, and I also saw that the research guiding our instruction rarely reflected Indigenous communities. When I began looking at the peer-reviewed literature in special education, I noticed how few studies centered Indigenous children and families. That realization shaped my decision to pursue graduate study. I wanted to understand how research could better reflect and serve our communities. Over time, that desire grew into a program of research. First, I focused on literacy and then later expanded into autism services and community-engaged intervention work. What has remained constant is the grounding in identity and responsibility to community. I begin with who I am. I am Diné, and I am also a former special education teacher. My experience in the classrooms across the Navajo Nation has shaped the questions I now ask as a researcher. Across all the projects, there are three shared priorities that guide the work: equitable literacy, early literacy access, supporting children with autism and their families, and alignment of systems with Diné values and family priorities. And these priorities connect literacy and autism work together. My research developed in phases. So first, it started with early literacy studies, then parent-mediated autism intervention, then autism assessment, and now sustainability and systems change. Each phase built on lessons from the previous one. My early work during my time as a PhD student and PhD candidate focused on shared reading and culturally relevant literacy practices for Diné preschoolers with disabilities. I wanted to understand engagement and vocabulary development in culturally meaningful contexts. I asked whether preschoolers with developmental delays were more engaged with general picture books, culturally relevant books, or tactile, squishy books, using a single case alternating treatment design that was done at a distance via Zoom, and I worked with 3 preschoolers. The engagement was high across all book types. Cultural books did not reduce engagement. In fact, engagement remained strong. This work resulted in publications that are here on this slide, and the study contributed evidence that distance delivery and culturally grounded materials can support engagement. The related publication stemmed from this work with the squishy books, and that one is about creating culturally relevant squishy books for Indigenous preschoolers. This slide visually highlights the dual focus of literacy engagement and vocabulary growth. Engagement is necessary, but vocabulary growth demonstrates instructional impact. Next, I examined whether culturally relevant dialogic reading increased vocabulary. I used a single case multiple probe design with 4 Diné preschoolers and targeted 9 vocabulary words from culturally grounded books. All 4 children demonstrated clear vocabulary gains with strong fidelity and inter-observer agreement. Maintenance was also demonstrated, suggesting lasting learning. And the mothers that of the students that I worked with, of the children I worked with, they reported noticing meaningful growth in their children's language. Their words affirmed that the intervention felt beneficial and relevant. And one quote from a mother was, after she was asked, was the dialogic reading intervention beneficial for Allie? She said, yes, because it helps her grow her vocabulary. And I've noticed that she's been speaking a lot more when she started school in August. You know, I'm actually really happy. When asked how important it is for culturally relevant books to be used in schools, families emphasize the importance of children knowing their cultural background and learning about other cultures. Cultural relevance was not supplemental, it was foundational. Another mother shared, after she was asked, why is it very important that culturally relevant books are used in school? I think it's important for kids to know where their background is and where their local community is coming from. You know, different cultures, especially even if it's not your own culture. I think it's important to learn where other people come from and where your friends come from. A manuscript is in preparation that will share these pilot findings more broadly and contribute to the culturally responsive literacy intervention literature. These studies taught that cultural relevance supports learning and families value grounded practices. The literacy work led naturally to autism support. Families expressed broader needs beyond literacy, particularly around autism identification and services. Diné Parents Taking Action is an adaptation of an evidence-based parent education program. It builds on the ecological validity framework and community health worker delivery models. While I was in my PhD program, an opportunity for being a project coordinator for an already in progress project was presented to me. And this work is deeply collaborative. It includes researchers, family advisors, advisory board members, interpreters, and community partners. The strength of this work comes from the collective effort. So when I joined this project, Dr. Lindley and Dr. Henderson were principal investigators, and I was brought on as the project coordinator. The project evolved over time. After I graduated, they invited me back on to come on as a co-principal investigator with them on the project. The participatory approach ensured adaptation decisions were guided by community voices, interview findings, and cultural frameworks rather than imposed internally. And you can see our study team and community advisory board. We had a project interpreter, community partners, and then our funders. And the Parents Taking Action intervention was developed by Dr. Sandra Magana for Latinx parents of children with autism. and it used a community health worker model that was used with Latinx parents of children with intellectual and developmental disabilities. And the ecological validity framework guided the adaptation across language, persons, metaphors, content, goals, methods, and context that ensured alignment with cultural values. The project included the interviews, the adaptation of the parents taking action manuals, and then it included a pilot trial with Diné families. And we focused on feasibility, acceptability, and preliminary outcomes. Parents described the diagnostic process as emotionally complex. Some reported long wait lists where they had to wait a long time to have their child receive the assessment, and also long travel times. And then also access to service varied widely. Some families shared positive and negative experiences with referrals and care coordination. Families also identified clear opportunities to improve autism service access through bringing more autism awareness to the community and autism-focused support groups. For AIM 2, we adapted the materials using intervention mapping and community advisory input, as well as parent interviews and findings. And the adaptation included the manuals, the videos, and resource guides that ensured both cultural and contextual fit. And 13 caregivers participated in this pilot. 5 Diné family advisors were trained to deliver the program. And this table here on this slide shows the measures that we used. The outcomes were positive for Diné parents taking action. Improvements were found in advocacy, understanding rights and support systems, and there were also trends toward improved mental health and child communication. In addition, the family advisors and caregivers, they gave positive feedback, not only regarding the lessons, but on the relationship that they built with during the project between the family advisors and the parents that they taught. Family advisors even offered to stay in touch with the parents that they were teaching after the lessons were complete. There were several peer-reviewed publications that came from this work that documented the adaptation process, feasibility outcomes, and qualitative findings. And Ascend builds on the Diné Parents Taking Action project by embedding delivery within clinical partnerships and expanding community reach. The Ascend project addressed the limitations of Diné Parents Taking Action not having a comparison group. So with Ascend, we aim to serve 25 to 30 families and evaluate outcomes using a randomized waitlist control design and build sustainability within local systems. In Ascend, as I mentioned earlier, we used a randomized waitlist control group, and survey data was collected at 3 points. And then there was also a focus group interview. 5 family advisors were trained, and we did weekly check-ins with them, as well as monthly group check-ins with the family advisors to give support. And there will be a future publication regarding the outcomes of the ASCEND project. Then comes Advancing Haut in Autism Assessment, which is an NIH-funded R21 that examines alignment and misalignment between autism assessment practices and Diné cultural beliefs. And the team here includes psychologists, health scientists, speech and language pathologists, and education researchers. So for this project, there are multiple principal investigators, which are Dr. Jensen, Dr. Lindley, and Dr. Henderson. And then myself and Dr. Lee are co-investigators on this project. There are 3 research aims, and we are interviewing parents, surveying, and then also interviewing practitioners. And the 3rd aim is to observe assessment teams to understand assessment practices from multiple perspectives. We also have a community advisory panel that is made up of community members that include Diné parents of children with autism, professionals with clinical autism experience, and also autistic individuals. And they provide feedback on materials, interpretation of findings, and development of recommendations to improve assessment practices. Our next steps include completing the data collection, sharing community updates, and disseminating findings through publications. Now we're moving into some project proposals that I am a part of. So STARS extends the Diné Parents Taking Action project and ASCEND project to additional tribal communities. It will embed AAC supports, so augmentative and alternative communication, within the manual, and also provide AAC support to the family, including training. And then the 3rd aim, which I will lead, is to adapt the manual for educators so that the Diné parents who have a child with autism will teach from the manual educators. And the manual includes information about child development and working with children with autism, using evidence-based practices to work with children with autism. And so with this project, I am working as a multiple principal investigator for this proposed project that we hope to have funded. And we hope to expand this to additional communities, because we have received feedback from other parents who have a child with autism from various tribes who would like to have these lessons. And so we're beginning with Hopi and building a partnership so that we can adapt the manual for Hopi families and begin to have families in Hopi receive these lessons as well. Another project that is in a proposal stage is Project SKODEN-ASD. It addresses the invisibility of Navajo children in autism data by generating tribally governed estimates of autism prevalence across early intervention and K through 12 systems. It will integrate administrative data with lived experiences of families and educators and clinicians through an interview portion of the project. It will also be grounded in fair and care principles, and the project plans to build a sustainable Indigenous-led system for ongoing tracking of autism trends over time. And if you're not familiar with the fair and care principles, fair principles, they aim to improve the reuse of scholarly data by ensuring data can be found and utilized. And then the care principles address the need for ethical and culturally appropriate data practices for Indigenous peoples, making sure that the data is being used in ways that benefit the community. So as I began as a teacher, asking practical questions, how do I support engagement? How do I grow vocabulary? Those questions led to my early literacy studies using single case designs. And then as I continued, I realized that cultural relevance involves more than materials. It requires process, it requires listening. So through collaboration with doctors Lindley and Henderson, and through Diné Parents Taking Action and Ascend, I learned what it means to build research along families and advisory boards. And over time, the work expanded from pilot studies to randomized trials to hopefully more NIH-supported projects. What has remained constant is a grounding in community, and what has grown is my understanding of how research can be shaped by partnership. My journey reflects growth from classroom teacher to literacy researcher to community engaged autism researcher, guided constantly by community voice. And as I reflect on this journey, I'm aware that none of this work has been done alone. I'm grateful for the mentors who have invited me into collaboration and challenged me to grow as a scholar. Their guidance shaped not only my research skills, but how I think about responsibility in community engaged work. I am grateful to our community advisory boards and family advisors. They're not just consultants, they guide the direction of the research and hold us accountable to community priorities. And I'm grateful to the collaborators and training programs that strengthened my methodological skills and supported my development at each stage. And most importantly, I'm grateful to the families who trust us with their experiences. Their willingness to share their stories is what makes this work possible. And my hope is to continue building research that is rooted in community and sustained through partnership. This work exists because of mentors, community advisory boards, collaborators, and especially the families who trust us with their stories. These are some training programs that I mentioned. The first one is NCRE. This is one out of the University of Colorado that gave research career development support. And then Indigenous data set through University of Arizona that offered sovereignty and ethics training. And then Pearl out of Arizona State University and University of Montana that promote public health careers of early career faculty working with Indigenous communities. And finally, but these are not all of them. There's been more than these, but these were some of the ones that I wanted to highlight. Also, the Community-Based Participatory Research Institute, which is at the University of New Mexico, gave me a great insight into community-based participatory research. So I just want to say a thank you, and emphasize that this work is grounded in culture and guided by community and focused on long-term sustainability and capacity building.